In early 2020, as the world came to grips with the outbreak of COVID-19, the United States faced one of its most challenging public health crises in decades. At the helm of the nation's response was then President Donald Trump, whose handling of the pandemic became a subject of deep political and social division. From the outset, Trump's approach to managing COVID-19 was marked by both controversy and complexity. The pandemic initially presented Trump with an unprecedented situation. In February 2020, he formed the White House Coronavirus Task Force, led by Vice President Mike Pence, to coordinate the federal response. However, as the virus spread, Trump was criticized for downplaying its severity. In early press conferences, he often likened COVID-19 to the flu and suggested that it would miraculously disappear as the weather warmed. This contradiction between his public statements and expert advice from scientists such as Dr. Anthony Fauci led to confusion and criticism. Throughout March and April, as cases surged, Trump's administration implemented travel restrictions from China and later from Europe. These actions were framed as crucial in curbing the virus's initial spread. Yet, there was significant backlash regarding the timing and effectiveness of these measures, as well as the administration's overall preparedness. The lack of widely available testing in the early months frustrated many Americans and healthcare professionals, leading to questions about the federal government's readiness. As the pandemic progressed, Trump emphasized the economic repercussions. In April 2020, he launched the Opening Up America Again plan, encouraging states to relax restrictions and focus on economic revival. This decision was met with mixed reactions. Supporters argued it was necessary to mitigate economic collapse, while critics feared it could exacerbate the health crisis. Trump's emphasis on individual states' responsibility to determine their own lockdown measures further fueled debates about federal versus state authority. Perhaps one of the most contentious issues during Trump's response was his stance on mask mandates. Despite health officials championing masks as a simple yet effective tool to reduce transmission, Trump was often seen without one, and at times criticized the necessity of masks. This stance became a flashpoint in the broader cultural and political battle over personal freedoms and public health. The advent of the COVID-19 vaccines in late 2020 was a pivotal moment. Operation Warp Speed, initiated by Trump's administration, successfully accelerated vaccine development and distribution. This was hailed as a significant achievement, demonstrating the power of public-private partnerships. Yet, by the time vaccines became available, a deeply divided public trust had already been established, affecting vaccine uptake. By the time Trump left office in January 2021, his administration's handling of COVID-19 remained a deeply polarizing topic. For some, it was characterized by decisive actions like the rapid vaccine development. For others, it symbolized missed opportunities and inconsistent messaging. Trump's response to the pandemic reflects not only the challenges of managing a rapidly evolving public health crisis, but also the complexities of leadership under intense scrutiny and political polarization. In retrospect, Trump's handling of the COVID-19 pandemic serves as a fervent reminder of the intricate dance between governance, public perception, and the unforeseen threats that can redefine a presidency. The legacy of those choices continues to reverberate, influencing public health policy and political discourse in the United States to this day.